Hello, my name is Dr. Fredrick Clark. I am coming to you today to discuss with you dental advocacy and some of the work that I've been doing for the past 12 years in dentistry. The reason that I thought it might be important to bring this issue up is because in my community where I practice, the Washington, D.C. area, a child died from not getting a tooth pulled. Many might find this to be surprising, amazing that someone could die from not getting a tooth pulled, but it's something that we are aware of in the dental community. In the African American community, dentistry has not always had the highest profile. We find that we are not aware that we need to visit the dentist on a routine basis, and we have many factors that affect our ability to receive care. In Prince George's County, in Temple Hills, Maryland, where I practice, a child, 12 years old, died because he couldn't find anyone to give him either medication, treatment, or an extraction that ultimately led to him having an abscess that led to brain surgery, and ultimately he died. The cause of this is multifactorial. Some of those things that might have caused this were the inability to get medical or dental coverage, the inability to find a doctor who would treat him without this coverage, the inability for the parent to understand the severity of her child's condition. I have been involved in advocacy in the state of Maryland for 12 years. I had noticed that we had a large number of patients who were trying to get treatment who couldn't because they couldn't get coverage under Medicaid, or they couldn't find doctors who were willing to treat them under the Medicaid plan. During my advocacy work, we were able to go to our state legislature, we were able to go to concerned parties and stakeholders to explain to them that there was a crisis of care in our communities, and we needed for them to become more involved in making sure that we create access to care for some of the underserved and disadvantaged citizens in our state. Fortunately, we were able to get our legislators to understand that they needed to increase the amount of funding for Medicaid, and ultimately we went from a budget for Medicaid dentistry of $3 million in 1998 to $81 million in 2010. What this has done is actually opened up access to care. And so now we have a scenario where we don't have to have a situation where a child may die from not being able to get to a dentist.
Dr. Clark, what is the one thing parents should need to know?
I think that we say the one thing that parents need to know is they need to be more aware about childhood dental disease. In other words, parents should be more aware of what a cavity looks like. They should be also aware of the fact that dental disease progresses painlessly, so if you don't look at your children's teeth, then you may not know that they have dental disease. Also, children need to be taken to the dentist at least twice every year, because the dentist will be able to recognize gum disease, early tooth decay, and problems that a child may have long before they become critical. Unfortunately, our parents are no more aware of what goes on with their children's teeth than they are with their own. Everybody has the attitude that if they're not in pain, then they don't have a problem. Well, this is far from the truth. The truth is that dental disease starts painlessly. It can progress to a very severe state, and by the time you get a toothache or you start to see bleeding in your gums, you have some very, very serious problems going on. So we highly recommend that we need, in the dental community, to change the language that we put out to our parents, to our patients, about how they take care of their teeth. We need a new type of dialogue so that parents can understand about not only the children's teeth but their own, how to do a better job of taking care of the teeth.